Thank you for joining us today at Barcelona Health Hub. It's a pleasure to have you here. Can you introduce yourself and tell us about Dedalus?
Hi, hello. My name is Marisa Felipe. I'm the General Manager of Dedalus for Iberia and North America. So, what is Dedalus? Dedalus is an IT healthcare company. We are top 3 at global level, and we are the market leader in Europe. What do we do? So we can say that we give service to more than 7,000 healthcare organizations. We provide our solutions to more than 6,000 laboratories and diagnostic centers, and overall our solutions give service to more than 400 million patients. So what's our goal and our purpose? We want to provide solutions to help the professionals, all the stakeholders on the healthcare ecosystem to bring value to the patients and be more effective in the processes.
Thank you. And we are thrilled to have you as a new member of Barcelona Health Hub and as a new resident. Why did you decide to join our digital health ecosystem?
Well, 2 reasons. So first, Barcelona. So the locations. Barcelona is a city that has decided to put focus and invest on healthcare, and this will help attract talent. That is key for us. And the other thing is the purpose of the Barcelona Health Hub. So your purpose and our purpose are common. So we want to innovate. We want to innovate with our Catalonian customers. We want to work with the healthcare ecosystem, and we really want even to progress and make innovation projects at the European level. So this alignment of the Barcelona Health Hub purpose and our purpose and the city make us choose the Barcelona Health Hub.
Yeah, and what about the location to place your innovation hub at our headquarters?
Well, in fact, one thing is the building, what is great. I really love it, and then is the ecosystem of companies that are already located here, and all the initiatives that the Barcelona Health Hub is launching to really drive the innovation that we also want to drive. So these 2, and in the hub that we have here in Barcelona is part of the overall hub that Dedalus have in Iberia, where we are innovating on our healthcare platform, on an analytics platform, on our open healthcare record, and also from this hub we are doing not only new solutions but also projects to our Catalonian customers, to our Iberia customers, Europe, and even the rest of the world.
Great. Do you want to elaborate more on the different innovation, scientific innovation areas that you focus on?
Well, one of the things that drive Dedalus and one of our focus is a continuous innovation, and we innovate with purpose. So we don't have a focus on technology, although of course we will be using the last technologies that are coming, and I refer here to artificial intelligence, automation, and of course having security and having open standards underlying all our solutions. But we always try to innovate with purpose, and the purpose of our current innovation is really try to optimize the healthcare processes, making it more efficient, improving the quality of care, improving the healthcare outcomes, and making also the life of the professional easier. And something that is very relevant for us is providing a more relevant role to the patient. So let's say that when we talk about the purpose, one thing is the underlying technology, everything new, we try to see how to adapt it, but this purpose of improving the healthcare outcome, let's say overall, would be the maximum goal of our innovation.
Great, thank you for sharing. Would you like to provide some examples of these innovative solutions?
Yeah. Let me mention a couple of examples. One is a command center solution where we are developing, and I will go to a very specific example. We are helping a healthcare organization to optimize the use of the operating theater so that instead of, for instance, making 10 operations per day, they are able to increase 10-20%, and that will be a very good tool to reduce the waiting list for operations. So that would be, when I look at outcomes and efficiency, that's for me a very clear example. Another example is a chronic care solution where it has two very different areas. One is a tool for the patient, where the patient will be able to control some of the clinical measures, so for instance the blood pressure, or to follow the exercises that have been asked by the doctors. And it's helping the patient control and be empowered to better control his health. And on the other hand, all this data will go into the system and will allow the organization to detect any deterioration on the patient situation on a proactive manner, so that if something may happen in the future, they detect it in advance and they may do an appointment and avoid that the patient will have to go to the hospital. So really prevention and patient empowerment. As I said, the purpose is efficiency and better outcomes.
Perfect, thank you so much.